Hello, my name is Jennifer Pope, and I'm a nurse in a centralized triage location. And I'm here today to talk about physicians and triage nurses collaborating to reduce response time for triage messages. Our Regional Operations Center is a centralized facility that supports local medical practices. The triage nurses in our center field calls and provide directions to patients for approximately 8 internal medicine practices, which encompass 36 healthcare providers. That number will be growing in the future. The triage nurses communicate with the practice or healthcare provider through messages sent via electronic medical records or through what we call flow managers, which are certified medical assistants in the practice. Currently, the workflow for these triage messages requiring physician advice is that the messages are sent to the flow manager, who has 4 hours to send to the healthcare provider. Once the message is answered by the healthcare provider, it was sent back to the flow manager, who then had an additional 4 hours to contact the patient and complete the message. And during this time, the triage nurse is left out of the communication with the patient to complete the call. What we found with this problem and the purpose of our initiative was to reduce the wait time for the patient from initially speaking with the nurse to resolution of a call by the healthcare provider. To accomplish this, it was felt that eliminating routing the message through the flow manager and forwarding directly to the healthcare provider would decrease turnaround time. Once the healthcare provider made a recommendation, the message was sent back to the triage nurse. The intent was that the same nurse who originally spoke with the patient would contact the patient with a recommendation or instructions of the provider and close that loop for the patient. It was also hoped that patient satisfaction would increase with a shorter response time. The hope to improve patient satisfaction and decrease turnaround time was the focus of this initiative. This slide that you're seeing, this picture, is actually a graph that shows comparisons of times pre and post. The green columns that you'll notice, those are prior to the initiative, the amount of time it took per day, an average number per call. And the blue columns that you're seeing are days of the week post-initiative. Corresponding days were, of course, compared Monday to Monday, Tuesday to Tuesday, etc. And you can definitely see that post-initiative, with using this new initiative, that it did show a great decrease in time. This second picture that we're seeing is actually an average of the percentages. Again, each day of the 2 weeks that was done, with the average percentage per day, the average percentage of improvement with direct provider and communication. So you can see with most of these days that as a whole, we were well above 50%. And the results that were found from this, a comparison, again, was made pre and post initiative, the time it took to receive a response from a provider after a triage message was sent. And on average, it showed a 64% reduction in the amount of time it took a patient to receive a response from the physician by the nurse with using direct provider communication. In terms of patient satisfaction score, that same comparison showed an improvement from 78.23% to 82.77%, and that was just in the first 2 months of using the initiative. And given this significant decrease, the initiative could be disseminated to other physician practices in a large healthcare system to produce a similar reduction in response time. In conclusion, our access to direct provider communication to close the loop with the patient has been a success in decreasing response time back to the patient and increasing patient satisfaction. Again, the results showed a 64% decreased response time to the patient after initiating direct provider communication within the first 10 days of the process change. Patient satisfaction scores improved 3.99% in the first 3 months of the development of direct provider communication.